So the O'Neill Institute, founded in 2007 to focus on both global and domestic law as it relates to and at the intersection with health. The Institute has 25 full-time staff and faculty, 50 RAs on in a given year, as well as interns. And it was created to generate innovative solutions when it comes to the most pressing domestic and global health concerns. The idea is using law as a tool to address these health problems. So current challenges that we were asked to kind of address, and you all know the Institute, et cetera, four that we want to highlight as we think about right now moments that we're in. So one is the opioid crisis. So here in the US, the opioid crisis is very clear, and the Institute is responding to that by bringing on actually a new initiative and a new project director that's focused on addiction and public policy, with increasing attention to the international context, where we're seeing increasingly opioids go global. And so what does that mean? And there's very few folks focused on that, and that's one piece that we're responding to. HIV and hepatitis C here in the United States, we have an initiative, the Infectious Disease Initiative, that really focuses on that, including at the cutting edge of some of what the health service delivery pieces should be. Reproductive health and NCDs, including a major focus on obesity. The Healthy Families Initiative that's just been launched is focusing on this intersection to really harness the idea of a Catholic university thinking about the broader context of families, including what families need when it comes to good food, and thinking about these things in a legal context. And then finally, global HIV and TB, but also the deficits in accountability and political will when it comes to the international system of global health. And there we have the Global Health Policy and Governance Initiative. We have, and you'll also allow me to apologize because I thought we were in the next section rather than this section, so I've also under talked about the LLM, but we'll do both. The LLM that we have, the Master's in Law, it's a degree for people with a first degree in law, with both domestic and global lawyers who are coming to the program every year, approximately split half and half, 25 full-time students every year from 12 countries. 35 different specialized law courses are offered at the law school, as well as practical experiences, externships, and a variety of opportunities to really build the idea of global health lawyers. 180 graduates from 30 countries have gone through the program thus far. So what are the current evolving political and economic contexts in which we are working? And so we chose two to focus on. One is actually the growing reality of populism. That as we think about law as a tool, the law and legal claims remain powerful as a check on authoritarianism, but also as a tool for citizens to demand rights. And that is a key piece of what we're working on right now. The second, as mentioned by Bernard just now, is growing inequality. And as we think about law and policy as a tool that either advances or hinders health, we have to understand that the drivers of inequality often have legal roots, and that the side of public health needs strong legal arguments and strong legal capacity to both respond to threats, but also to advance the capacity of citizens to demand health in the law. Two opportunities in places where we're leading. One is kind of bringing the legal expertise, and so I won't go into the Lancet Commission, but John mentioned that, stolen my thunder, I forgive, and he was the co-chair, so he should steal the thunder, but led by Larry Gostin, that really is building the field of the legal determinants of health. I can't tell you how many people have recently talked about John and Larry's work to me as really cutting new ground when it comes to kind of really creating this as a field within both academia and within the practice of global health. The second I'll just highlight for a moment is on NCDs and obesity, that we think can be responded to with law, and it can be done globally. And so our Healthy Families Initiative is currently convening civil society, lawyers, and public health people to both defend public health laws that support good public health, but also to advance measures that demand that the state take action. Finally, I'll just say the final piece that we're really trying to lead on is a piece on empirical rigor. That as we think about what laws are actually linked to better health outcomes, we have intuitive sense of what that is, but we don't always have evidence for it. And so a new project that we're just launching called the HIV Policy Lab will track which policies related to HIV have been implemented by which countries across the globe and across at least beginning 3 years and many years to come, so that we can actually build evidence and ask empirical questions about which policies and laws are getting us better health outcomes and which are not.